Hello, and welcome to Rajai Media. This is History Notes. History Notes celebrate lesser known figures who have made equally important contributions to society. We are dedicated to bring you engaging and informative content recognizing people, places, and events that have shaped our world. Without further ado, I present to you History Notes. In 1948, there were four other surgeons who successfully carried out cardiac operations. Vivian Thomas was one of these four individuals. Vivian Thomas developed a procedure to treat synaptic heart disease, or blue baby syndrome. What makes Vivian Thomas so distinctive is that he did not have a formal education or laboratory research experience. Vivian began his career as a laboratory assistant to Dr. Blaylock at Vanderbilt University in Nashville, Tennessee in 1930. Without a college degree or research experience, Vivian was employed as a surgical research assistant, a job he obtained by asking a friend who worked at Vanderbilt if there were any job openings. Dr. Blaylock was responsible for the animal lab at Vanderbilt, where he conducted experiments on animals. Vivian Thomas's plan to attend college were diminished due to the Great Depression of October 1929. But let's go back and touch on synaptic heart disease, or the blue baby syndrome. The heart is the most vital organ in the body. It pumps blood and oxygen to every part of the body, along with other vital nutrients. Blue baby syndrome was first described in 1671. In 1888, this cardiac condition was named Tralgia Fallot, after a French physician. A Dutch physician in 1777 referenced a 16-month-old child suffering with this condition as the blue boy. In the pursuing years, the condition was termed blue baby syndrome due to the skin turning a bluish hue because of low levels of oxygen in the blood. In 1944, the first surgical repair was conducted by Dr. Alfred Blaylock, a surgeon at Johns Hopkins Hospital, and Helen Tusick, a cardiologist. Vivian Thomas was listed as an assistant. However, it was Vivian Thomas's contribution that saved the lives of many infants and young people suffering with blue baby syndrome. You see, it was Vivian Thomas who developed the technique, the procedures, and crafted the surgical instruments required to successfully perform the surgery on such a delicate organ. Vivian created the blue baby syndrome using laboratory animals at Johns Hopkins University. Again, at Johns Hopkins, Vivian was a laboratory assistant to Dr. Blaylock. In 1941, Alfred Blaylock was offered chief of surgery position at Johns Hopkins. He insisted that Vivian accompany him. It must be noted that Dr. Blaylock greatly benefited from the assistance Vivian Thomas contributed. Blaylock was the most noted American surgeon, but Vivian still was not recognized as a medical doctor nor a surgeon. His salary was that of a janitor. At Johns Hopkins and within Baltimore, segregation laws were in place. Black employees at Johns Hopkins were janitors. In 1943, Vivian Thomas created the cardiac condition known as the synaptic heart disease, or blue baby syndrome, in laboratory animals, primarily in dogs. He created the condition then corrected the condition using the cardiac procedures that he developed and perfected. The results of Vivian Thomas's experiments and procedures impressed Dr. Blaylock so much that Dr. Blaylock concluded the operation could be performed on humans. Upon inspecting the procedure performed on a dog named Anna, it is reported that Dr. Blaylock stated, "This looks like something the Lord made." The lab assistants trained by Vivian and those witnessing Vivian Thomas's performing the procedure stated Vivian's technique was so precise he could perform the procedure with his eyes closed. Many of the instruments and the techniques required to perform the delicate procedure were created by Vivian Thomas. Vivian fashioned and adapted needles and clamps required for this delicate procedure from the instruments used in the animal laboratory. Vivian Thomas also trained a host of surgeons while employed as a lab assistant during the 1940s. In 1944, the procedure and technique Vivian Thomas perfected was performed by Dr. Blaylock on an 18-month-old female infant displaying symptoms of blue baby syndrome. Dr. Blaylock and Johns Hopkins failed to recognize and acknowledge contributions made by Vivian Thomas. Over 200 patients received the life-saving procedure at Johns Hopkins, developed and perfected by Vivian Thomas. The operation was known as the Blaylock-Thomas II-6 shunt. Vivian Thomas was not allowed to operate on human patients. Even the articles published in the 1945 Journal of American Medicine Association did not mention Vivian Thomas, giving credit to Dr. Blaylock and Helen Taussig. Dr. Blaylock had performed the procedure once on a dog as he was being trained by Vivian Thomas. This would be the first time Dr. Blaylock would perform the procedure on a human. Dr. Blaylock insisted Vivian Thomas accompany him in the operating room. Vivian stood over Dr. Blaylock's shoulder, watching and providing verbal instructions and confirmation. The 18-month-old female patient's life was extended for several months before she passed away. 2 succeeding operations were completed successfully, one on an 11-year-old girl and another on a 6-year-old boy. Again, more than 200 patients with blue baby syndrome received the operation by 1946 at Johns Hopkins Hospital, some traveling over 2,000 miles away. Vivian Thomas championed over many negative obstacles to become a pioneer of cardiac surgery. He trained a generation of surgeons within his lab at Johns Hopkins, one being Denton Cooley. Many surgeons who were trained by Vivian Thomas became chief of surgical departments across America. In 1968, some of these surgeons commissioned a painting of Vivian Thomas and had the portrait hung next to the portrait of Dr. Blaylock in the lobby of the Alfred Blaylock Clinical Science Building. Vivian Thomas received an honorary doctorate from Johns Hopkins in 1976 and was named instructor of surgery for Johns Hopkins School of Medicine. However, rather than receiving an honorary medical doctorate, he was presented with an honorary Doctor of Laws. Restrictions in place at Johns Hopkins denied Vivian Thomas to be presented with the honorary medical doctorate. Vivian Thomas worked 37 years at Johns Hopkins. He was not allowed to operate on human patients because he lacked a medical degree. Vivian Thomas grandson of a slave, endured poverty, racism, job discrimination, pay discrimination, and was invisible and unrecognized within the medical world for his contribution to advance cardiac surgery. His contributions improved and saved lives of many countless people born with a heart defect. Thank you for joining us, and we hope you enjoyed the content. Our hope is History Notes will inspire you to seek additional information about the individuals or events mentioned. Don't forget to like, subscribe, and comment. See you at the next round.